I wanted to start out just talking about some common terms that I'm going to use in the presentation and that you'll probably hear others use. Very often when I do trainings with workplaces, when people hear the phrase mental health, they automatically think mental illness. I don't have a mental illness, so none of this applies to me. But really, it's important to note that mental health is so much more than mental illness. And that even folks who experience a diagnosis of a mental illness can experience optimal mental health and well-being. At NAMI NYC, where I work, all of us here are people with lived experience of mental illness, either ourselves or as caregivers. And I work with people at really optimal health and well-being every day. Related, someone who doesn't have a diagnosis of a mental illness can still experience mental health challenges, and that can feel really bad and really affect us both within the workplace and in our personal lives. So throughout this presentation, we'll be talking about mental illness, which is an official diagnosis, what I refer to as mental health challenges, which may not be a diagnosis, but a cluster of symptoms, something that's negatively affecting your life. And this will definitely be relevant as Jessica talks about her portion, which really focuses on the Americans with Disabilities Act and the relationship and differences of those. But all of this is to really say that mental health is more than mental illness. Mental health challenges can still feel really bad and affect us personally and in our work lives, and it's something that we want to address. And that people's needs will change over the years. And so I like this sort of continuum graphic in front of us because I think it shows that there are lots of different ways that mental health can affect us, that we can cycle through different quadrants at different times in our lives and need different types of support. Next slide, please. So here are some of the common ways that mental health challenges can show up in the workplace. And so I provide these terms and definitions, not because I want to be so much of a wordsmith, but because I think when we talk about our mental health, and especially in the workplace, it can feel really overwhelming. Getting specific about what we're experiencing can really help us identify what we want to do that will help us feel better. So on one side of the spectrum is stress, which I view as an over-engagement. This is where people can be feeling, symptoms related to anxiety. I think of people sending a lot of emails really late at night, sort of rapid fire at the point where it's beyond helping the work that we're doing. And clearly it's just become something that's so stressful and anxiety provoking that they can't really control what they're doing. It can be really overreactive emotions, thinking about someone in a meeting where they might just be ruminating or really focused on one issue and are unable to sort of break out of this cycle. On the opposite side of stress, which again can be viewed as this overengagement, is this idea of burnout, which I think is really an underengagement. It's where you feel constantly exhausted, no matter how much sleep you get. And I think the thing that really differentiates burnout from some of the other mental health challenges I see in the workplace is this idea of cynicism and negativity towards work. When I picture someone being burned out in the workplace, someone who might be sitting with their arms crossed in a meeting or rolling their eyes, it's this idea that really nothing will work. And so not surprisingly, if you're feeling exhausted all the time and feeling really cynical, it's going to affect your workplace productivity. The World Health Organization in 2019 declared burnout an occupational phenomenon, which was kind of a confusing way of identifying it because it wasn't saying that burnout was a mental illness specifically, but it was the first time that one of the main World Health Organization's publications said, there's something going on with the way that we're working and it's making us sick. And so we want to address that. I've done a lot of work around burnout with Dr. Christine Maslach's work out of the University of Berkeley, California, who really coined this term and identified these phrases. And burnout can feel really bad, both individually, it can spread out across teams. So if you have one team member who you see is experiencing burnout, it can spread out. And so you really want to make sure that you're addressing it before it gets worse. And so between this idea of stress as an overengagement, burnout, you kind of just stop caring, is this idea of languishing, which is just sort of feeling meh. You feel a bit stagnant, decreased motivation. This became a real focus of conversation in the first summer after the pandemic, when the New York Times did a big article about what does it mean for mental health, where you're not experiencing a mental illness, but you're not thriving in a way you would like to. And so while all three of these are not mental illnesses, if left unaddressed, these challenges can turn into mental illnesses. So it's something that we really want to be aware of and address sooner rather than later. Another common question I get when I show folks that slide is, I think I might have all three. What I would say to that is, I think if you're experiencing that negativity, that to me is a real sign that you might be experiencing some burnout. And again, it's important to note that because what you do for burnout can be different than what you do for stress or languishing. Next slide, please. So how do mental health challenges show up in the workplace? And you might have noticed that I'm really not talking so much about diagnoses, mostly because I'm not a clinician. And I think in the workplace, we always want to be really careful about making sure that we're not diagnosing someone else with something, especially as non-clinicians. But we want to be looking for changes in behavior. And this list that I'm showing can be some indicators that someone might be experiencing a mental health challenge. I think it's a drop in work quality. Someone who used to be on camera and be really active in meetings all the time, and now they're off camera and are no longer participating. We can see it in challenging interpersonal relationships. This was a big topic at the start of the pandemic when I was doing this work, when folks shifted lots of Slack chats where you didn't necessarily know the person that you were talking to, you didn't see them on video, and seeing some of the stress really show up in these interpersonal conflicts in the workplace. Another sign can be fast or hard to follow speech or erratic behavior. So again, we don't need to focus so much on clinical features as non-clinicians, but really just look at, are there changes in behavior where we might want to reach out and be like, hey, is everything okay? Next slide, please. Because in addition to the great impact on individual mental health, where it feels, really terrible and it can be really challenging to have mental health challenges or experience mental illness, poor mental health also impacts the workplace. Jessica is going to talk about this a bit more, but not surprisingly, workers who are diagnosed with mental illnesses are both absent more from work, absenteeism, and less productive when they are in the workplace, presenteeism. Neuropsychiatric disorders are the leading cause of disability, which I was really surprised by when I learned that. I would have thought it would have been injury or something specifically related to the workplace. Mood disorders are the third most common cause of hospitalization among adults ages 18 to 45. And I think that's a really telling statistic because most people during that age range are going to be in the workplace. So odds are you will at some point encounter people experiencing mental illness or mental health challenges in the workplace. And so again, while the real focus on this is really for individuals and how challenging this does occur at a significant cost to employers in reduced productivity and increased healthcare costs. Next slide. So we have a whole host of speakers and we could talk about this for hours and hours, but since it is Mental Health Awareness Month, I wanted to provide some of the strategies that we talk about in some of our trainings about how to cope with workplace stress and mental health challenges. So here are 3 just quick tips that you can use to try to support your own mental health. So the first is about communicating with your leadership. This can be your manager or your overall firm leadership. A lot of challenges that I see in the workplace related to mental health and otherwise are about a lack of clarity around what are the goals? What am I supposed to be working on? Who is really leading this work right now? If I have multiple people telling me what to do, how do I know what to prioritize? Use the opportunity to communicate with your leadership to make sure that you're aligned on your goals, to make sure that if you're experiencing some challenges, that you can just let them know so that they understand what you're going through and can maybe just, realign expectations for a bit. Very often when folks experience mental health challenges, it's not going to affect their work at all, but it can go a long way to just, give your manager a heads up and say, hey, next couple of weeks, I'm having a hard time. And very often managers will say, do what you need to do. And it doesn't require any of the more formal accommodations, although it can, that Jessica is going to talk about. The second tip is about creating guardrails for your time. So this term guardrails came from Anne Helen Peterson in a sort of viral BuzzFeed article several years ago. But it's basically the idea that boundaries have become permeable, especially as many folks are doing hybrid work. I'm sure some of you are coming now from your living rooms to dial in. So a guardrail differs from a boundary in that boundaries are permeable, but a guardrail is really a firm setting for what you want to do and how you want to do it. So some practical ways to do this are letting folks know when you will be sending emails, what your timeframes are. If you have some real heads down deep work that you need to do, shooting an email to your team saying, hey, I'm going offline for the next 2 hours to focus on this. If you really need me, you can text. Creating these really firm guardrails can help you protect your own mental health. And also, if you're a leader, model for your team that it's okay for them to do for themselves. And finally, choose your responses wisely. There's a whole host of research about the role of mindfulness in the workplace. And I think for many of us, especially as we get along in our careers, we realized that there are certain times where it's really important to sort of pick your battles in the workplace. I think this is especially true with managers. How do we communicate with our team? What do we think is really important? Deciding the areas that we really want to focus our attention on, and maybe letting some of the other stuff go. This can feel really challenging. And so if folks, have their own mindfulness practices that they use, we'd love to hear in the chat about how you really operationalize doing this. But again, I think there will be times where it's really important to, push through and work through some of these challenges or conflicts. And other times where, maybe it's okay. I look back on a job I had in the past where I would have a lot of conflicts with my boss about PowerPoint template headings. And I look back and just think that didn't need to happen. This was not worth the stress that I was adding onto it. So again, these are just 3 quick tips for protecting your own mental health. And, hopefully, and if folks want to share in the chat any ways that they found to operationalize these, I recommend doing so. But on the next slide, I really just want to stress that mental illness can feel really overwhelming at times, and it can feel really hard to cope with it, but that recovery is possible. One study found that 80% of people, and these were employed individuals who received appropriate care and treatment, were able to go on and live and recover and lead happy, meaningful, productive lives. And so this is a picture from a NAMI NYC walk in years past, which is actually happening this Saturday at the Seaport. So I hope to see some of you there. We'll talk about it a little bit at the end, but it's just really important to note that a mental illness, you can recover, and employment can be an important part of that recovery. On the next slide, we'll talk about, though, if recovery is so available and important as part of mental illness, why is it so hard for people to seek out help, especially in the workplace? And I think there's a very real stigma attached to talking about mental health challenges. And the stigma, I think, has decreased in sort of the general conversation, especially with the pandemic, where people have been talking more openly about this. But that can feel very different in the workplace, especially in a very high pressure, high power workplace. And so, some of the ways that stigma shows up in the workplace can be stereotypes. I was in a support group for adult children, people with mental illnesses, and an individual talked about his sister had been diagnosed with schizophrenia, and that it was really hard for him to hear people saying really horrible things about people living with mental illness in the workplace, but he didn't feel comfortable saying anything about that because he was worried they might think he was crazy or that there was something wrong with him. There can be a lot of fear. People may experience bullying, all of which can lead to people feeling hopeless, which again affects not only our mental health, but also can affect our trajectory towards recovery.